level.
Great. So I'm Carol Aschenbrener from AAMC, and our group focused on how can we assess approaches to interprofessional learning. And we touched on many of the issues that you mentioned, but the two overriding themes were evidence, evidence, evidence. And that was at many different levels. First of all, trying to lobby accreditors to have evidence-based regulations and break out of the restrictive time, site, and limitations, for example, in simulation hours that really curtail innovation, to evidence for impact, to evidence for which technologies are most effective, which pedagogies are most effective. The second big theme was the need to have approaches that don't rely on live clinical practices because we simply don't have enough of them now. And the one at the forefront, of course, is simulation and going from the lowest fidelity to the highest fidelity, a large variety of approaches. So we looked at a number of opportunities, and we actually got very focused at the end and decided we'd identify one strategy at each level. So the one at the meso level follows on the previous panel and decided that a number of professional associations could come together and jointly sponsor a MOOC on an area that would be relevant to interprofessional learning. My personal mantra is, let's get to the day when all of the content that doesn't require the social context of the classroom, direct patient experience or direct observation, let's put it all someplace else where it can be accessed asynchronously. So doing a MOOC together, but then evaluating the impact of that on the different professions and looking, is it as effective, for example, with pharmacy as it is with optometry and all of the different professions. And of course, that MOOC would have to be developed across a number of associations, which in itself could add to collaboration. Each institution would need faculty at different professions, which would, I hope, build collaborations. And then it should be used with discussion fora and so forth in a collaborative fashion. So I will stop there and let you move on.
What a fabulous, fabulous idea. Thank you.
Oops, sorry.
And let me add it, will you start next?
Yes.
Okay, question 3, and you're going to focus on the strategy at the micro level, right?